Autism is basically a developmental disorder, and it's a complex one. It's characterized by difficulties in social interaction, communication, repetitive behaviors, and because it's just like we know that symptoms usually, come up from childhood. So it's something that has to do with the brain development. So any disruptions in the developmental processes of the brain is what results in conditions like autism. And so it affects communication, social life, behavioral skills, and also some other things that have to do with interactions in every child. So it usually starts from infancy because it's something that affects the brain, just like I said, and it's expected that as soon as you expect the child to start manifesting behavioral changes in social skills and all, those are the periods when autism is picked. Although for some that might not be knowledgeable about it, they might miss it. But it's usually very easy to pick once, especially for people that are already used to what is expected in the developmental milestones of every child at all. So they are able to pick these differences early from infancy or childhood, maybe not infancy, but from childhood.
So how would you say autism is diagnosed, and what factors influence the diagnosis processes?
Okay, so unlike other diseases, there is no test, no laboratory test to diagnose autism. Rather, because it is behavioral thing, it's something that affects the social skills, communication, and all. So it's usually diagnosed through a comprehensive evaluation that assesses a child's developmental milestones, which include the language, the motor skills, and social interaction. Then there is also behavioral observation. So clinicians really have to observe the child to be sure that, okay, this behavior is an aberration from what is normal for that particular age of that child, like play, social interactions, and even responses to sensory stimuli. And another thing that can be done to also diagnose, or that is done in addition to the above to diagnose autism, is medical evaluation. So there's a need to rule out that there is no problem with the brain itself, because when there is a problem, there are a number of problems that can happen to the brain, and some of these problems too can manifest in ways that are similar to autism. So it's a combination of checking if there are other things about the brain, the behavioral evaluations, and also developmental assessments that help to hone on the diagnosis of autism.
What are the key differences between autism and other developmental disorders such as the ADHD or sensory processing disorder?
Autism have close or similar features with some other diseases, like you mentioned. We have ADHD, we have antisocial personality disorder, but there are some things that are just peculiar to autism, like the repetitive behaviors, the absence of social skills. They are particular to autism. For instance, in ADHD is attention deficit hyperactivity disorder. So this is usually characterized with inattention and hyperactivity on the part of the child, just like the name implies. And in the antisocial personality disorders, it's basically a personality thing. So such children are aggressive, they repeatedly break laws, they are repeatedly telling lies, and they're even reckless about their lives. So, and for this one, the diagnosis is made later in life, like during adolescence, when you expect that children should have, should have harnessed all the moral values and everything and start putting them into use. That is when this is diagnosed. Unlike in autism, that the changes are noticed quite early in the life of a child, and it's not just maybe something about the personality alone. It affects their social skills, it affects their motor skills. They may just be doing some things repetitively. They may just have one particular habit that they do repetitively. They are not tired. That's the only thing they just focus on, and they are doing it. They don't interact with people. They try to avoid eye contact. They rarely smile. They might have preferences for some kinds of food and just want to continue to eat only want food. They might not even answer to their names when you call them. So these are the symptoms that are, peculiar to autism, that help to differentiate them from other similar conditions like the ADHD, antisocial personality disorder, and even sensory processing disorder.
So is it possible for an adult to develop autism or be diagnosed with it later in life, even if they were not identified as childhood, like when they are growing up?
It's not very common. It's not something that is common to find, because all the things that are involved or that are not normal in autism are stuff that you would have started experiencing from the early years of a child. So it might be, for adults, it might be maybe personality disorders that they learned over time, or that they begin to show over time, or even the sensory disorders, or maybe there is a particular problem with the brain, or organic problem with the brain that's affected any part of their brain, maybe the motors, the one that controls the motor skills, or the one that controls their personality or their social interactions. But for autism, you most likely would have noticed all of these features right from child, because they can't hide it. That is just what they see themselves doing, and they don't know how to do anything other than that. So it's not something that they just decide that they want to be doing it based on maybe what the environment delivers onto them, or what their parenting their parenting styles, or the environment they grew up. No, it is not something that is environmental. It is just what they find themselves doing. They don't have any ability or control over this. So most times it's from childhood that all these signs are noticed.
So what would you say are the most effective treatment strategies for autism?
So for the management of autism is multidisciplinary, and so because what it entails is also wide, so that's why we need a lot of disciplines to come together: the therapist, the doctor, the speech therapy, the counselor, all of them to come together as one. Each of them will take up the role that is expected of them in managing such children. So the commonest therapy that is used for autism is what we call applied behavior analysis, and it's widely used because it teaches children new skills and helps to reduce challenging behaviors. So in this particular kind of therapy, they are taught what is normal, aside as against what they are used to doing or what they feel is the normal thing. And because you have already been able to identify what their strengths are, what they have special interest in, so the therapy is focused. Yeah, it's focused on those strengths and the things that you want to change. It is not just a general type of therapy. It has to be individualized on the peculiarities of the child.
So aside from the different therapies you've mentioned, are there no medications or treatments available for autism?
No, because this is not an organic problem. So except if along the line such child also has some other medical conditions that need medication. But basically for autism and the disorders that fall within that spectrum, there are no medications, injections, or anything to change them. It's basically therapy. They need cognitive behavioral therapy, speech therapy, and the applied behavioral analysis. Those are what are used for them.
Okay. So can autism symptoms improve with age?
Yes, it does. Because by the time all these therapies have, as in the child has gone through all of these therapies, we expect appreciable changes, improvements in them, although they might not be like children without autism, but at least they would have had some level of improvement in their skills, their motor skills, their interaction, and also any other thing that has been found to be deficient in them with time, especially when the intervention is very, is individualized and it's really intense. With time, there will be improvements, and when there are also good support system around them that help them to put into use whatever they've learned through their therapy sessions.
Are there specific early signs that parents rather, and caregivers should watch out for in young children?
Okay, so at one point or the other, we expect that parents or would-be parents would be familiar with developmental changes in children. Even if it's not their own biological children, they've at least interacted with babies, children around them, and know those things that are involved in every stage of development. So any deviation from any of these expected should be reported, because the earlier the symptoms are picked, the better the outcome would be. So and the signs that we can look out for are developmental language delays, like when the child is expected to speak at the age that the child is expected to have started making cues, making monosyllabic words and responding to gestures and everything. Such child just goes mute, does not respond to call, does not respond to stimuli in the environment, as in speech and interactions from the parents or people around them. Then some children don't make eye contact. Each time you want to look into the eyes, get to express yourself to them, get close, they just want to avoid such persons. Some of them have difficulty with social interaction. They just want to be on their own, playing with just one type of toy or doing just one type of play from the beginning of the day to the end of the day. So these signs are not normal. And when noticed in a child, don't just say the child is just cool. The child just wants to be on himself or stay alone. No, it is not normal. Children naturally are very, very social or sociable now. So if you interact with them, if you smile at them, they want to smile back. But for an autistic child, if you smile to such, he or she reciprocate the smile.
Are there particular strategies that can help individuals with autism succeed in an educational setting?
Okay, yes. For autistic children, the major thing that helps them educationally is having special schools for them. So you don't want to put them in regular schools because their needs will not be catered for. Remember what we said about the features they have. So putting them in special schools, are the best, because all they learn are tailored to their own personal needs. Their curriculum is usually personalized, and they are allowed to evolve over time at their own pace. So their learning is at their own pace. It is not any strict curriculum that is usually followed in educating them. And you also do not have very high expectations, like, okay, at the end of this school session, expect known this, known that. No, it's usually something that is the curriculum will be personalized and will be at their own pace. So we have individualized educational programs for them that are tailored basically to meet specific needs. So they are not the kind of children you want to teach numeracy, literacy, social studies, everything. It's just basic things that they need for survival and livelihood, and that probably would help their abilities and the skill set that you want to enhance them. That's what their own educational programs are tailored towards. Then another thing is that it should also be they should also have structured learning environment. It shouldn't be something that is so rigid. It should be, you would probably some level of routines for them, because they are getting to learn things that are not their usual ways of life. So you have to keep doing it and doing it and doing it until eventually it becomes a part of them, and they're able to adopt it and begin to also do it in return. Then they need a lot of visual support, of course, because at least they see, even though they might not hear, they might not understand what you are telling them, they might not be able to relate whatever you are saying, but visual aids help them a lot to learn about the environment, to learn about whatever thing you want them to learn about, behaviors, about interactions, and you see them enthusiastically, they flow with these visual aids that are used for their learning. Then the social aspect of it is very, very important. They have to, as a matter of compulsion, as a matter of important, be taught how to develop social skills and friendships, interactions with their colleagues and with people around them. So basically, these are the things that their curriculum usually center around, and not the regular curriculums that we have in schools around. So I think, to the best of my knowledge, we have some schools in Lagos, in Abuja, and maybe in some other areas in Nigeria that are specific for autistic children, and they do a lot of good job.
So what would you say are the most common misconception about autism, and how do you think they can be addressed?
So the first one is that many people, especially in this part of the world, see autism as evil possession. So when they see a child with autism, they say the child is possessed or the child is evil, like it's an abnormal being. So, and that, that also informs the way the way they relate with such children or even their parents. I just watched some things online about what somebody commented about a mother that has an autistic child and is constantly posting it on social media, what she's doing concerning him and all. And these comments are heartbreaking because they are not in the woman's shoe. They don't understand how it goes, and it's easy for them to just pass derogatory remarks about such children. And another thing is that some people believe that it's as a result of bad parenting. They'll say, oh, this child is false. That's why would the child behave like this? It's because of the parents have handled the child right from childhood and all, and they don't know that of disorder. So there are some children that might not manifest the full spectrum of that disorder. They might just manifest a few of them, while some will manifest all of the disorders that are on that spectrum. So not all of them are the same. Some of them have appreciable social skills, while some of them don't have at all. Some of them are able to communicate. So that's why every training, every therapy has to be tailored to the need of that child. Then some other people think that autism is rare, though it might be because people don't come out to say their child are autistic, or they don't even present in the hospitals. They just keep such children at home because they are embarrassed. They don't want to present themselves as having this kind of special needs children. But the reason it's not really rare is just because the reporting is low. In Nigeria, for instance, we have about 2.3% overall prevalence of autism in Nigeria, and in the southwest we have as much as 1 in every 43 children, and in the southeast 1 in every 125 children, according to a particular statistics. So these are the common misconceptions about autism, and the best way to actually pull down these misconceptions is through awareness. We have to keep talking about them, just like you have done good by bringing this topic on air. We have to keep talking about autism. We have to keep educating parents. We have to keep enlightening the public about conditions like this. And I think the World Autism Awareness Day is 2nd April. That's the day that has been designated to honor children with autism, and also get the public aware about this condition, the features to look out for, how best to manage them, and also how to support parents that have these special needs children.
How can we better support autistic individuals in adulthood, especially as they transition from childhood to independence? Because we expect that the support should have been from childhood. So we are not just going to be waiting till they get to adults. While they are going through their therapies, while they are going to school or they are learning environment, the whatever treatment, whatever exposures you are giving them, it's already towards what you want them to become, what kind of adults you want them to become. So the transition should have been a progressive thing. It is not just when they become adults and I say, okay, now you have to start learning the survival skill. No, you have to have discovered it right from the beginning and start initiating such child, or encouraging, training them, getting them to get more skills in those particular aspects of life, so that by the time they get into adulthood, they already grow into such things. They are used to these styles of life, and they are just able to continue like that. Other things that should be done to support them, because they are
to a large extent, they are still dependent. They can't do a lot of things on their own. They still require, people to be around them to render one kind of support or the other. And one of such that they would need is employment that they are able to fit into. They should not be, totally cancelled out of opportunities. They should be given the kind of opportunities that they can fit into in terms of employment, the housing, healthcare, and any other thing that might be peculiar to them should be given, if not free of charge, but should be made at least accessible and affordable for them. Then there should be places for them to relax, to bond, to interact with one another, because they can best interact with one another because they fall into the same category. So maybe we could have groups of people like that, so that maybe on regular occasions they come together, they interact, they bond, and also give them opportunities to get involved in social gatherings and social activities, to not just putting them by the side and say, oh, you can't understand what is going on there. When you are going for a party, I expect that you should check your child, or maybe an adult that is autistic. Let them also go there. Let them also, vibe to the music, enjoy the company of the plenty people that are on ground and everything, because it will also help their own social life as well and their social skills. So then there should also be mental health support to them, because by the time they become adults, they understand that they are in one way or the other different from other people. So that might tilt them towards depression or anxiety. But if they have a supportive group of people around them that make them to feel at home and feel accepted and loved, it helps them to accept themselves and also appreciate themselves for who they are.
So from the different types of therapy or intervention models you mentioned earlier, how do one determine the best approach for each person with autism?
Like I mentioned earlier, I said there is no one-size-fits-all therapy. It's usually a multidisciplinary thing. So there is no situation whereby it's just one person, maybe just a speech therapist that will be in charge of a particular person. However, every therapy will be tailored towards the needs of the child. So for a child, it might be the language therapy, the speech and language therapy that should be the most paramount. Maybe he or she is better with other stuff. So you take them in order of preference and give them those help as the need arises. While for some, it might be the motor skills. For those that have maybe motor delays and all, so those you tailor the therapy based on the need of the patient. So you don't just say, okay, everybody, this particular month, we are going to be learning how to talk and interact with our environment. No, it has to be based on the need of the child. That is the best way. The best way to go about it is to personalize it, to make the system to be individualized and not just any general kind of intervention. And you put into cognizance what their peculiar needs are, behavioral, social, and all. They nail them on the head and do a lot to help them in all of this. But it's usually a combination of all the therapy: speech therapy, cognitive behavioral therapy, the applied behavioral analysis, and any other therapy that might be needed.
How does sensory sensitivity manifest in individuals with autism, and how can they be managed effectively?
So the sensory sensitivities might be a case of too much or too low. So they can have oversensitivity to some stimuli. That's strong reactions to stimuli like sound, touch, light, and taste. As in, those reactions will be way out of proportion to whatever the magnitude of the stimuli is. Like maybe just a gentle touch on an autistic child that has oversensitivity, it will just flare up or just show kind of agitation, and you'll be like, oh, what just happened? While for some other, it might be under sensitivity. You touch them, you don't even know you're touching them. There's a very bright light and you expect them to wink or to squeeze their faces. They are not doing that. Maybe there is sound, a very loud noise, and everybody is there holding onto their ears and trying to protect their eardrums, and they are just looking like there's nothing going on around them. So it could be a case of undersensitivity or oversensitivity, and it might be one stimulus to many stimuli. So whatever the stimulus or stimuli is that have been identified to be a case of sensitivity to them are the ones that will be worked on during their therapy sessions. And the management too is also through all of these their therapies. And you also might have to carry out some investigations to rule out other organic brain disorders that might also present in the same way these sensory sensitivities present, because we have a particular disorder about sensory sensitivity. So it might just be that alone that is the problem. So you have to be able to rule out that from autism and manage accordingly.